Khayelitsha is one of the biggest townships in South Africa, and it is located about 30 or 40 kilometres outside of Cape Town. It has one of the highest rates of TB and HIV in the country. So the decentralised model of care in Khayelitsha is based around the patient, and it aims at improving outcomes through diagnosing more people and starting people on treatment. And that is enabled by the model where we allow patients to access treatment from their local clinics with a better treatment regimen, better diagnostic techniques and more support for the patient.
I had the first test where I was told I had normal TB. Then I was put on treatment for a month. Then I was told later on that I had drug-resistant TB.
We see different types of TB. Apart from the regular drug-sensitive TB, we also see drug-resistant TB, which can be divided into multi-drug resistant TB or MDR TB and extreme drug-resistant TB, which is XDR TB.
To take the MDR treatment, if I want, I could go to the hospital, but I chose not to. I chose to take the treatment from the clinic. And then I was referred to the support group, which is a drug-resistant support group run by AMSF. For me, being home was much better than being at the hospital. I was still there for my children. I was still there for the things that I have to do. So even though I was sick, but the sickness did not affect me to an extent that I felt like paralyzed and not able to do anything. Because I think being at hospital could have meant that I couldn't do the thing that I was able to do.
One of the main aspects of our program is support for the patient while they are taking their DRTB treatment. So we have a social assistant and we also have counsellors. The counsellors see patients on a one-on-one basis when they start their treatment to provide intensified counselling for them. They also carry out home visits where they visit the home and they give infection control advice to the family, they educate the family and they reiterate the messages they gave in the first counselling session. And they are also used to track defaulting patients if they have stopped taking their medicine for whatever reason. So by decentralising drug-resistant TB treatment, people have access to treatment sooner and they are able to stay in their communities where they can get support from their families to continue their treatment.